Thanks, everyone. Thanks, Neil. As Neil mentioned, my perspective is from HRA. And HRA is a consortium of over 90 nonprofit, non-governmental funders of biomedical research. And our mission is to maximize the impact of research to improve human health. And so this logo slide shows you that we are extremely diverse in terms of size and mission and the research areas that we focus on, including quite a bit of discovery and fundamental science. And which shows you that, of course, our data sharing plans, data management policies are quite diverse as well. But we do know that a significant number of HRA member organizations know that increasing access to the data that results from their funding could be an important tool in maximizing the impact of their funding. But they may not understand the full issues or might not believe they do have the resources to implement and enact really good policies. And yes, and nod to yesterday's discussion, I do fear that many are waiting until it's perfect before we dive in. And one of the reasons for that, I think, is valid. We do fear unintentionally harming some of our most vulnerable populations, such as those in under-resourced labs. So in 2018, we conducted a survey of our membership and asked, where are you on this continuum of from the left exploring and finding out what policy would fit you and your organization and your mission? Or do you already have a really robust policy and you're just monitoring compliance? And what we found was most people were still over here, though we had many that were rolling up their sleeves, doing the research to find what policy would fit their research area and their mission. We had some working on buy-in of their stakeholders, including their leadership and their scientists, because of course, we believe that mandates are not the way to go. It's more effective if you have a policy that can that demonstrates value. So several have had draft policies that they were getting feedback on, and 10 actually had rolled out a plan, which is pretty cool. But we heard that they need a little help on education materials. Are there, what is out there that can help us implement a policy, develop and implement a policy that can have a significant impact on the research area without overburdening the researchers? And we did hear that many actually asked about data sharing in the application and in the progress report stage, but none of them scored the strength of the data sharing plan in the review. It was just administrative, if anything. And with respect to monitoring compliance, it was a shrug. How do we even do that in a non-resource intensive way? So to help our members move from the left to the right, we launched a data sharing working group. And that was to inform members about the issues. What is fair data? What's the difference between a data management plan, a sharing plan, data availability statement? What are the tools that are out there to facilitate the sharing, like the DMP tool? We do need to help members communicate the value of data sharing and identify elements of your policy that fit your mission and resources and can actually have an impact. But what we did that was really important was we created this learning community with shared successes, challenges, and resources. We believe that a clear and consistent set of expectations across funders, across sectors actually, could make data sharing normative. So after that, just this past spring, we resurveyed our membership and asked again, where are you on this continuum? And there were still some here, but fewer. We had many more organizations that were rolling up their sleeves, doing the research to find what policy makes sense for the research that they fund, the mission that they have, who their stakeholders are. Is it patients? Is it much more discovery research? And again, buy-in. So if you are a patient advocacy organization, it is important to make the ROI to your patients, to your scientists, to your boards, to your donors. There are now quite a few templates and data sharing policies that HRA members can use and plagiarize for their own use, including the NIH one. So that's helpful. 18 members now have rolled out a plan. And the data sharing working group has curated, collated, and even created some of our own educational materials. We found what the NIH has created, like the supplemental guidance on repositories, is very helpful. There is a lot of material out there, but it's very disparate. We can't, it's not all in one place. So we did put in a lot of work finding it, linking to it, and that's been very helpful to our members. And with respect to the grant procedures at the application stage and the progress report stage, more organizations are asking the question about data sharing on the application and on progress reports. There's more administrative review looking at who checks that box. Yes, I've shared. Here's a DOI or here's a citation, but scoring the data management plan is still very rare. And monitoring compliance, again, how do you even do that in a non-resource intensive way? And let me tell you that is one of the barriers. We're a little hesitant to put in place a policy that we can't even monitor. So we can't enforce compliance, we can't reward it, and we can't penalize anybody by bashing them over the head with a carrot. So what will help HRA members and other funders go from the left to the right on this consortium? I think we need some fair resources, or maybe FAR resources. I don't know about the interoperable, but at least they need to be findable, accessible, and reusable. Success stories that can demonstrate the ROI to leadership, researchers, patients, et cetera. Just like Patty Brennan shared yesterday about the COVID example, these are going to be very important. It's not enough to just say sharing data advances science or sharing data accelerates discovery. We need to have real examples of downstream use leading to innovation. And these are the examples that are going to show, when it's true, that putting money towards data sharing policies can have a higher impact than awarding a few more grants, if that data is shared in a way that enables reuse. Again, it may or may not be. I think Phil Bourne was talking about this during the break. It depends how much money we're talking about, and it's kind of local, what you fund, what your mission is. But if you can make the case that putting money towards data sharing is more impactful than a few more grants, I think it's important to do that. And also highlighting funder policies that are successful. We heard yesterday about seeing yourself. I think that would be important for funders to see themselves in other successful policies, and it could lower the barrier to their forward movement towards implementing policies. We also need to know what data we're talking about and when, where, and how. And of course, we need to stress how and when to use DOIs, the importance of citations, all of that. What is critical metadata? So these are things that we need to highlight to anybody who's interested in forming a policy, how important they are. And of course, the elements of a robust management or sharing plan or a data availability statement. We heard a lot yesterday about machine readable. Does it need to be at this point? Does it need to be fair? And let's have that discussion. Template language is huge for us. So we're gonna hopefully put NIHs up there so people can learn what's important in a grant agreement. To us, reviewer training is huge. We do not wanna put this task on our administrators, the grant reviewers, the grants administration. We feel that most organizations feel that this should be a part of the external review, but we know that to do that, our reviewers need training to make this a fair and effective scoring as part of the application process. So that's going to be key. And hopefully the NIH staff who are doing this in the interim can share their experiences, what they learn, and we can work together to do some reviewer training modules. And it's also very important to know how to adequately resource our data sharing policies. It's not cheap. How do we budget for it? And how do we add additional resources for our researchers to help them comply with our policies? We also need technology and partnerships. We need technology that links data generation to the outputs like protocols and codes in real time. If we do this, it embeds this in the research workflow. So it'll improve the research, but it also lowers the perceived burden on the researcher. So compliance would be much higher. We really need a system to track and evaluate this behavior. So right now we can ask them, what data have you shared? I think we need to ask, how have others used it? And how have you used other data? This is really important. If we say that we value this, I think our grantees will say, wow, I don't want to leave that blank next time. So are going to think about using others' data to advance the field. And we talk about citations and using DOIs. I think it's also important that we know how to commend our grantees for good behavior, maybe with an index or a badge. We don't have leverage after our grant term ends. So how do we help the community know who the good sharers and who the bad sharers are to inform promotion and tenure, subsequent funding, things like that. And we also know it's very important to partner across sectors. Governments, academia, publishers, we need to set some consistent expectations for data sharing. We do not want publishers to be the ones to set those expectations. That's too far down the line. Data has to be born fair, as we heard yesterday. So here are my takeaways. We need a fair resource library, including what we heard about earlier today, data on data sharing. We need those success stories. We need to know what effective policy and plan elements are. These tools and guidance are going to be very important. Selecting a repository for data, put the link to the DMP tool right out there for everybody to use. Reviewer training, a cost estimator that's specific and relevant to your research field. That's going to be hugely variable. Again, template terms and conditions language, compliance language can come in there. Technology really can help us hopefully monitor compliance. I know we can look at downloads now in Figshare, but can you see what people are doing with your research? And can you brag about that? When you can brag about that, I think that will change compliance. We need to badge good behavior. And again, we need partnerships across the sector. And with that, I will stop sharing.